Almost 6,000 cases of dengue have been reported this year, and this is the highest ever number of cases reported in India. What's causing all the confusion? Viral fever presenting with dengue symptoms, dengue presenting with viral fever-like symptoms, people being treated for dengue without the test being positive. We hope to clear all your confusion with our panel here, the expert panel here. So we have Dr. ALKA CHADHA, who's a senior pathologist practicing in Navi Mumbai since the last 25 years. We have Dr. Akshay Challani, who is a general physician practicing in Navi Mumbai since the last 7 years. We have Dr. NIRANJAN PATIL, who's a senior microbiologist from Metropolis Healthcare. And we have Dr. AMIT, who is a pediatrician practicing in Navi Mumbai, and he also works at the D.Y. Patil College and Hospital. Dr. Akshay, what are the classical symptoms of dengue and how is it different this year?
Classical symptoms, the name itself suggests actually dengue fever. So first important is that patient has to have fever, important thing. So most of the patient what we see dengue fever, the dengue patients, they had a fever first thing. Second, there are a lot of body pain actually, muscle pain, mostly in the lower limbs and all that. And second day, third day, they have the nausea or vomiting. Because sometimes dengue has a potential to affect your liver, and the function of the liver is digestion. So they will have a nausea and vomiting. So this time, as compared to the last year or previous year, we are seeing that dengue is affecting your not only the liver and that blood system, but it is also affecting your brain. So in the medical term, we label as encephalitis. That is one thing. And sometimes more severe form, we are observing the patients who are bleeding, basically, who are bleeding from the intestinal tract actually. So there are 2 or 3 types, little bit different from the last year and previous years. But the important symptoms, fever, body pain, pain in the eyes, nausea, and feeling of vomiting. These are the main symptoms. And my suggestion to the common people, don't ignore the symptoms. Fever more than 2 days or you feel uncomfortable, don't do any self-medication and just approach the doctor.
But these symptoms are very common, even viral fever present with such symptoms. Then how can people differentiate? Or do you suggest that anybody who has fever for more than 2 days has to visit a doctor for dengue?
Yeah, my suggestion, fever more than 48 hours, you just take a paracetamol. After 48 hours, still the fever is persistent, you go to the doctor. Or suppose the fever is there, with the fever, suppose you develop breathlessness, giddiness, whatever the amount of urine you are passing is less, or severe headache, immediately go to the doctor. Don't take aspirin, don't take Disprin. But as and when suppose there is a fever, but you are eating well, you are doing your routine activity normally, there is no too much of tiredness, no need to approach directly to the doctor immediately. But fever persistent at least more than 48 hours, please go to the doctor.
And above what temperature do you think it is?
By definition, if it is more than 100, you will label as a fever.
Yeah.
So when I talk about the adult, fever will not harm you too much. But if fever is more than 100 or 101, you can just do the tepid sponging, take simple paracetamol. But suppose you require more than 2 paracetamol per day, you go to the doctor. But high grade fever, you don't get panic actually. So just do the tepid sponging, the things will be all right. In the bachchus in the pediatric department, a little bit different actually. Fever, you can't, he will talk to you. Yeah. But in the adult, fever, you don't get panic. Just take one simple paracetamol, don't take aspirin. Just do the tepid sponging and then approach to the doctor.
In children, actually, the symptoms are very non-specific. As he rightly said, fever is one of the predominant symptoms. It's not possible that dengue fever is presenting without fever. So they do have fever. Apart from that, they might also have very non-specific symptoms like cough, cold, and especially in children, younger children, it becomes very difficult to for the children to express that he is feeling headache or he's having a body ache. He'll just say he is not feeling well, or he will just stop eating. That's the first thing that the children do. So for us, it becomes very important what the parents are giving us the history. So the parents are there with the child throughout, so they can tell us that as compared to earlier, he's definitely not eating well. In between the fever also, when a fever is gone down, he is not still up to his mark. Otherwise, in normal viral fever, what happens is when the fever has gone down, the child becomes comfortable, starts playing around. But in dengue fever, there will be still interfebrile period also, they will be not comfortable. Then the urine output comes down, the appetite goes down. And if the child is big enough, he might say that I am getting severe headaches or retroorbital pain, that's pain behind the eyes. So in cases of such fevers, it's definitely recommended that the parent should get the child to a doctor. We can assess them, if required, do a blood test and take the necessary measures.
Should they also wait for 2 days like in adults
Uh,
sooner?
Not they can give them medicines like paracetamol at home also, but if they feel that the child is much dull as compared, because the children the reserves are very less, so even if for one day they are not eating well, they may get severely dehydrated, so we don't want that to happen. So in case the child is not eating well, it's better to consult a doctor immediately. Blood tests do have a collaborative role, but the clinical profile of the patient is much more important. So if the child is looking sick, even with a 70,000 platelet count, I'll be admitting him. But if the child is looking well, I might still monitor at home also. If the parents are also comfortable, from a pediatrician's point of view, it becomes a very sensitive issue. They panic a lot. So if they say that the platelet is so low, but we are comfortable at monitoring home because the child is eating well, he's passing good amount of urine, and he is comfortable otherwise, I might still decide, okay, there's no need for admission. But at 70,000 counts and he's not eating well, and his urine output is low, is looking dull, in that case, I'll definitely keeping him under my observation in the hospital. So the indications for hospitalization will be depending on the clinical profile with the blood picture.
Retroorbital pain is something, and severe backache, severe backache with fever. Okay, it will actually point towards dengue viral infection. That is something which it should be on the lookout. Or typical manifestations, or maybe in adults, patient can have sometimes fever with rash. But this year we are not seeing that much fever with rash. Pediatric patients, yes, definitely,
the rashes are coming up, but the rashes are also coming up later in the illness. It's not immediately on day 1 or day 2 of illness, but day 4, day 5 of illness. In fact, when they recover, they get more of rashes.
What kind of rashes?
It's like a erythematous rash all over the body, sparing some parts, reddish rash. And in fact, when the recovery starts, there is a clinical symptom of itching which is coming up. So once the itching comes up with the rash on there and the platelet counts improving, the child's general condition improves, that means that the child is out of the critical phase now, and then he is not going to be suffering from any other complications. There are 2 phases basically. One is a febrile phase and the second one is a defervescence where the fever comes down. Now in this defervescence phase, that is the most critical phase actually. When the fever comes down, either the child can improve and go home, or he might go into complications. So that is the time when we have to be more watchful about it, rather than be happy that fever is gone now, nothing is going to happen. But if the fever has gone down and the child is still looking sick, dull, not eating well, urine is less, he's getting edema because of the effusions coming up, pleural effusion, ascites, that is fluid accumulating in your abdominal cavity, limb edema, periorbital puffiness. So all these symptoms will point towards a complicated phase where the plasma leakage is happening. The capillaries became leaky, and all the fluid which is running inside your vessels comes out into the extravascular compartment. So that is actually a critical phase, and which again your fluid management becomes very important.
So it's not just about the fever, but the phase after the fever that you need to be more careful about. I don't think many people know that.